Hi, my name is Eileen Fowler, and I am a physical therapist, and I also have a PhD in biomechanics and motor control from UCLA. And I do clinical research in Duchenne muscular dystrophy. So Duchenne muscular dystrophy is a genetic sex-linked muscle disease that affects males, and females can be carriers but don't typically manifest the disease. Typically, a child, a young boy that's 3 or 4 years old, may not be running or keeping up with their peers the way that they should be expected. So they'll go to the pediatrician and eventually may get referred to a neurologist or an orthopedist, and they'll do a test and find out that they have this disease. So it's fairly devastating to the families that their child that they thought was just a little bit clumsy now has what's currently fatal muscle disease. Historically, physical therapy has not had a lot to offer this patient population. We really want to work on restoring function, improving strength in a patient that's weak. But if we exercise these children, we can actually contribute to accelerating the breakdown of their muscles. So it's a delicate balance that we want to encourage movement, because if they don't move at all, obviously they could atrophy, the muscles could atrophy in addition to the disease process. So we want to keep them as active as possible. So a lot of therapy surrounds education of parents about the activities that the child can do. So biking and swimming is an excellent activity where it's very difficult to damage the muscle. The primary focus, though, of essential therapy needs to be done by the parents every day, and that is the stretching exercises. So the child needs to wear night splints to keep their ankles in a good position so that they don't end up, because they walk up with their toes a lot, sometimes they lose that range of motion where they can't get their foot flat on the floor even if they wanted to. And that could lead to them walking slower, tripping, and not being efficient in the way they walk. Physical therapy has become very important in trying to make sure that the children do maintain range of motion, and for those that are walking, it's at the ankle, and do wear those night splints. So also, if they are in a wheelchair, even if they can't get their feet flat on the pedals, then that can throw off their posture. It can cause some problems with their knees or hips or their spine and lead to curvature of the spine or scoliosis. And now that we do have these new therapeutics, we're hoping that the children can also have greater hope for being able to exercise these muscles, because if they do have some dystrophin, then they can actually have more exercise without damaging the muscle is what we hope, so that we have children that can be stronger in the future and benefit more from some of our therapeutic exercises approaches. But right now we're really trying to look at maintaining the musculoskeletal status and the best health that we possibly can. So sometimes we are a multidisciplinary team and we all work together, and there's so many disciplines in clinic. We have pulmonary function tests that need to be done, and there's cardiac tests that need to be done, and then also the very important genetic tests and looking at what their specific genetic cause is. But for I think all families, they really do appreciate speaking with the physical therapist and learning what they can do, because it actually is something that families can do for their child to maintain the best health and alignment for their children, and then also to be able to keep them playing and happy and healthy to the best of their ability. Working with these boys and men that have Duchenne muscular dystrophy and their families, has been very rewarding and inspiring. One of the things that I find very interesting is that when we look at health-related quality of life, when you ask questions about happiness, now you would think that if a child became a lot weaker and they ended up becoming a wheelchair user and their future was uncertain, that they would be very sad maybe, or worried. And that's not what I see with the adolescents and young men that have this disease. I think that there is really good communication with the families. I think when you're facing a disease like Duchenne muscular dystrophy, there's a really strong bond between the parents and these young these boys, adolescent boys, especially young men with Duchenne muscular dystrophy, and they feel very loved and supported by their families, by their parents, and by their siblings, and you can really see that. And I think that that's just something that I found to be very inspiring, that even though they have this terrible disease process, that it hasn't affected their spirit.